Dental implant process. We're going to replace the whole jaw on something what we call All-on-4, All-on-6 or All-on-8 implants. The more implants you use often creates more and more stability. We may need to do also sinus lift or bone graft if you have bone loss in a certain part of your jaw. Now this is simply just like placing flour in soil. You need to put a little bit of soil around the flour after we've cleaned out the area to make sure that the flour holds in the soil. So this is all that the bone graft simply is. It's like putting soil around a new flower that you've just put in the ground. And consider the flower being the dental implant. So the implants in either 4, 6 or 8 positions symmetrically are placed. On that we will put the same day what we call a semi-permanent bridge, so that you can go home, start smiling and eating right away for day 1. But hold on there, the full treatment is not finished. So we can get the best aesthetic result for you long-term for the rest of your life. We're gonna ask you to come back 3 months later and then possibly once again for 4 or 5 months for impressions of the final bridge work, and then last visit, final bridge work, 10, 12, 14 crowns in an arch that look fantastic and take your whole smile to the new level.